Autism is a neurodevelopmental disorder, and the characteristics of it are difficulty with communication, nonverbal expressions, things like pointing and gesturing, and those impairments lead to a significant decrease in ability to kind of function in a social world. The behaviors of autism often get in the way of developing relationships with other families. They're often judged. You know, if you just use a little bit more assertive discipline with your child, then they won't have these crazy behaviors, and that's not the case. The child is wired differently, the brain works very differently. We know that through functional MRIs, but yet society still views those behaviors as a discipline problem. A neurotypical child can learn very easily because they're wired to do so. Kids with autism don't, and so they just need prompting and coaching to help them learn those skills as well. The thing that's neat about autism is there's such a variety of kids, and people will often say, if you know one child with autism, you know one child with autism. Kids with autism are like snowflakes. There's no two alike. And so what works for one child doesn't necessarily work for another. And that's what's so important about problem solving. In training the scholars, we try to get them to problem solve so that they can figure out what the child needs. Oftentimes, the diagnosis will be so firm. Yes, your child has autism and they will go into an institution. And to be that sure about what a 2-year-old or a 20-month-year-old, what their destiny will be, is surprising to me. But these kids make amazing progress. Most of them are going to make significant progress if you get it early enough. In about 1/3 of the kids with autism that are diagnosed very young and get intensive early intervention, about 1/3 of those kids will actually go on to be indistinguishable from their peers, meaning that they'll lose some form of their diagnosis. However, most of the kids will continue to have these symptoms, and so the families will have to, over time, help them to deal with it. The way to do it is to get them to express what they're feeling so that they're able to explain it.